Hello, everybody. Welcome to this new FECTU webinar. Today with us, we have Sofia Ramos, a veterinarian and a good friend from Portugal. I just would like to introduce Sofia by saying that Sofia performed several externships abroad in the UK, US, and Belgium before qualifying from the University of Trás-os-Montes and Alto Douro in Portugal in 2013. After 1 year working in a mixed practice, 2014-2015. She did an internship in equine medicine and surgery in Belgium. Straight after that, this internship, she moved to the University of Pretoria as equine surgery assistant. And in 2017, she moved back to her homeland and developed research in equine orthopedic disease as main focus of her PhD with emphasis in the Lusitano horse at the University of Évora in Portugal. In 2019, Sofia joined the University of Liège as equine surgery assistant, and in 2020, she started her residency. Currently, she's working towards the ECVS diploma. Sofia, thank you so much for accepting this. It is a pleasure to have you here with you. As I mentioned, we are trying our best to cover all different types of topics in this FECTU webinars, because with the YouTube channel that we have, we try our best to have a good library of videos. So it's really nice that you accept to cover this topic on common problems in draft horses. Sofia, thank you so much. Over to you.
Thank you. I would like firstly to thank João for inviting me to speak about these amazing horses, which are the draft horses. So the presentation is focused on the common problems that we see usually at the University of Liège. And I made the presentation quite simple and vocabulary quite simple because it's more towards, as João told me, owners. This presentation was made along with Dr. Sigrid Gruke. She's a diplomate ECVS with a vast experience working with these horses. So firstly, let me just introduce ourselves as a team. So as you said, I'm doing my residency at the University of Liège. We have the Department of Surgery and Orthopedics, where we have Professor Certain, Dr. Gruke, Dr. Salsiccia and Dr. de la Rivière, Dr. Caudron and Dr. Nazareth-Storms, along with my colleague, Dr. Anaïs. So this is the Department of Surgery and Orthopedics only, but we have internal medicine, ophthalmology, anesthesia, imaging. So we work all together as a big team, reproduction, and each one of us has its own department of interest, and we help each other when there's something that goes out of the box of each one of us. But not less important, in our team, we have as well our farriers. So we have Pascal and Johan, along with Remy, who do a great job, especially with draft horses. It's not usual that we have farriers keen to do draft horses because they are not the same as a 500-kilo horse and not as easy to work. We have a stock just to work with these horses, and they do a great job helping us out as well on consultation beside trimming and showing the horses. And if you come to visit us, you might come across with our interns that live in the hospital and give us a great hand with consultations and all hospitalized horses, as well as surgeries. Where are we? So we are located in Belgium, in Liège, and as you can see, we have Luxembourg, Germany, Netherlands, and France. So which means we have horses coming from everywhere. We are about 1 hour from the borders to up to 3 hours. And it's interesting because that gives us a huge case log. We have many types of problems in extra large dimension. So it can be as simple as a colic on draft horses. A couple of weeks ago, we had a mandibular fracture, or it can be more complex, such as a colic surgery or an arthroscopy of joints or articulation. So what we're going to speak today, vaccination, how important, hoof problems, skin problems, tendon joints, muscle problems that we see common on draft horses, respiratory system, and finally a brief talk about reproduction, namely the following. Tetanus vaccination, is this important? So I decided to speak about this because 2 weeks ago I had a draft horse presented for bronchopneumonia, and the people has been 10 years with the horse and they never vaccinated the horse and they were not aware. And this happens to me quite often. And I think it's quite important. Why? Because this disease, it happens due to a lack of vaccination. So we do a vaccination on annual basis. It's caused by a bacteria called Clostridium tetani, and basically this bacteria is going to release exotoxins. They're going to block neurotransmitters and result in spasticity of the skeletal muscles. So this can lead, as you can see on this video, to this prolapse. So this is very typical. They show this prolapse of the third eyelid. They have spasms, they colic, they can panic quite easily. And the masseter on the muscles, the masseter muscles on the head, they get quite rigid, and also very typical, they get the raised tail head as a clinical sign and symptom. This is a very painful situation, and unfortunately not always ends well for the horse. And the prevention, once again, is with vaccination. And if we have horses that are presented with wounds, we are not aware of their vaccination status, we do apply the anti-tetanic serum. So how does the bacteria get in? By wounds, surgical wounds, hoof fissures, neonatal umbilicus, and the treatment is extremely expensive and not always effective. So what we do is we place the horse in a dark room. We put cotton even in the ear so they don't get stimulus. We try to maintain the hydration and nutritional status because many times they are not able to drink or eat by themselves. We give high dosages of penicillin, and very advanced cases, which the prognosis is not so good, we might need to evacuate the rectum and place a urinary catheter because they are not able to do by themselves. And sometimes we have to put them on a sling to give a physical support because they cannot stand. So is this real, what I'm talking about? Yes, actually, it's very real. In Morocco, tetanus is the major cause of death among horses, donkeys, and mules. And not too long ago, Joan told me that there's 100 million horses, working animals around the world. So I guess this gets a lot of a whole dimension, different dimension. There is a report of 44 cases that died at a hospital, and only 46 survived to the treatment. And there is one case report from 2021 saying that a donkey was admitted to the hospital, and 9 months after treatment and going home, he reoccurred the problem. However, what I want to emphasize is if you vaccinate, it's 100% efficient. So there is no reports of horses that are vaccinated that develop the disease. Hoof problems. So draft horses commonly have, the most common actually problem is hoof problems. But they can be quite of a challenge because they are stoic, which means they do not show evidence of pain quite easily. And it makes it difficult for the vet to help out because, one, they have deep skin and they have long hair on the extremities. And to detect swellings on these horses can be quite of a challenge as well. In this video, I wanted to show you, this was a horse presented with a lameness 5 out of 5, which means he was not supporting the left forelimb. He was very painful, he didn't want to eat, and he showed increment temperature. Fortunately, there is some kind of transport, because some people do not know. There is this transport, and people specialized to bring horses with suspected fractures, namely draft horses, towards a referral hospital. So I think this is important because if you suspect that your horse has a fracture, the way we transport the horse is extremely important. And actually, this case that looked like a fracture was a hoof abscess. So we're going to speak about it very soon. And something to keep in mind regarding the draft horse is that they have a flat foot that lacks of natural concavity on the sole, which makes them prone to sole bruising. So as I said, the foot is the most common source of pain, lameness in draft horses. And in theory, we see that there is heat around the coronary bands. The horse might have digital pulse, and I put it in red because unfortunately on draft horses, we cannot get this data. A hoof tester, we get a painful response, but in draft horses, not always is true because if the sole is hard or very thick, they do not answer. But in here, fortunately, this was a case that the horse was presented very lame. And you see, we are doing the hoof testing, and he's not saying anything. And once we arrive to the toe region, you can see that he's not so happy about it. So he struggles to continue the test, and then he continues to do the test, and there the horse doesn't say anything. So this is indicative to the vet that something is going on. Sometimes we can get as well swelling of the coronary band around the hoof wall. However, in draft horses, this can be a challenge. So I do advise clipping because this can be quite helpful. Hoof abscess. So what we found on this horse was actually a hoof abscess. What is a hoof abscess? Basically, it's accumulation of purulent exudate located between the germinal and keratinized layers of the epithelium. This can be due to, or mainly, a trauma to the sole, so sole bruising. So it can be secondary to a misplaced nail by the farrier. It can be due to a break or fissure on the white line, or it can be simple as a wound, especially in horses that have flat feet and barefoot with thin soles. They are more prone to this. Why is the horse so painful? Mainly because it's due to the inflammatory response, and also because this accumulation of exudate and pearl pus, basically, it's gonna increment the subsolar pressure. So this is the horse walking once we drain and we place bandage. And you can see he's still lame at walk on the right hind. So we do expect that the horse gets much better between 12 to 24 hours after drainage. This is very important. If it's not getting better, then something has to be done by your vet, namely radiographs or other complementary exams. So how does sole bruising happen? So a small rock, it ruptures the blood vessel in the dermis, which gets the corium or the sensitive tissue. And it can be in the sole, frog, or hoof wall. And basically this hemorrhage spreads into the deep layers of the epidermis and becomes visible as the hoof grows. The bruises most visible, of course, they are on non-pigmented areas or superficial. But are all those hoof abscess? Not really. So we have three types of sole bruising. We have the hemorrhage that I just showed, and usually it's not clinical. We have the type of moist beneath the epidermis that gives a mild lameness to the horse. He's less comfortable. And we have the suppurative, which is corresponding to the hoof abscess. And this gives a severe lameness where the horse doesn't want to support at all the limb. So treatment prognosis, it's easy, it's not expensive. It's a teamwork between the farrier and the veterinarian. We do pain management, and sometimes we give antibiotics once the abscess is drained. But I do remind everyone that underneath the sole, there is actually P3, so the third phalanx of the horse, the bone. And if the bacteria located on the abscess migrate towards the bone, this can get an osteitis, which is an infection of the bone. And this might require something more surgical by a veterinarian, such as a curettage. Hypertonic bandage is quite important to soak all those pus and purulent exudates. And the potential complications is that if the horse is very painful on this limb, he's not going to support the contralateral, and so he can develop laminitis. So this is very important to control, along with the osteitis, of course. So once again, lameness must improve after abscess drainage. Another thing that can happen to anyone, it's very important to know, is that if you see that your horse stepped on something and it's quite painful and it seems to have an object inside, do not remove the object. Please call your veterinarian and get a lameness exam for him in order to do as well radiographs. Why is this important? So I put this picture and you can see here the hoof wall, and inside we have P3, P2, and P1, the bones. We have the navicular bone, and we have the deep digital flexor tendon that it's going to insert on P3. So if the nails accordingly to the place where the nail is, it can touch important structures, any of these that I just mentioned. So depending on where it touches or not, the treatment is totally different, and the prognosis as well. If your vet is not available, I do advise you to make a video, keep the object, and try to keep in mind which direction was going that same object. Hoof canker. So hoof canker is another hoof problem that we see quite often. What is it? Is a chronic proliferative pododermatitis on the horn-producing tissues that gets bacterial infection, where usually we see it on the frog, but it can be as well on the sole, on the bars, and on the hoof wall. It can affect any breed, any sex, any age. And basically this infection is gonna lead to the production of abnormal tissue that has this spongy-like aspect. And the symptom is fetid odor. The frog, when we touch it, it bleeds quite easily. The horse is painful. And as it advances the disease, the horse is less willing to lift the leg, and then he can even develop lameness. And you ask me, is it just one leg? It can get on the 4 legs even. So this can get a vicious cycle, so it's quite important to make the diagnosis. What is the treatment? Is surgical, so we have to remove the abnormal tissue surgically. And this is quite some time after the removal. This is when it's having some epithelialization and healing, and as you can see, the horse had on the forefeet. The prognosis is favorable if diagnosed early, so it's important to be quite aggressive. This demands from the owner a lot of patience and a lot of bandages, as you can imagine, until we get to this point. So we want a cornification, a normal tissue that doesn't require bandage anymore. Something to keep in mind is that hoof canker can reoccur. So it's important to keep an eye actually on the feet of the horse, on the hygiene, because actually the cause I didn't mention, but it's unknown. It's thought to be multifactorial. And actually, before it was thought that it was draft horses. It was thought to be on unhygienic situations of stall, but actually it was shown that it can happen in any horse. So for this reason, it's thought to have an autoimmune reaction. Cartilage ossification, what is it? So it's basically ossification of the complementary cartilages. So if you see this radiograph, we have of the draft horse, we have here P3 bone, okay? And this is usually cartilage, but it got ossification in. And this we see quite common on draft horses, and lameness is extremely rare. However, it's important to know that when they do ossify, they can give issues. And usually it's more the lateral than the medial cartilage. It has 5 grades of classification, and 4 and 5 can be possibly significant in a sense that can give lameness to the horse. Why does this happen? It's not clear once again. It's thought to be genetic factors. Medial lateral foot imbalance. So once again, failure plays a big role on this. The concussion, so impact, and the conformation of the horse itself. So it's more on the forelimbs, more on females, and actually can lead to a fracture. And this fracture can lead to acute lameness. So as you can see here, we have a fracture line that should be not confused with a secondary ossification center. This actually can lead as well to type 2 P3 fractures, which can lead to a chronic lameness. The diagnosis is made by radiographs, but only radiographs itself is not enough. Usually we do a block regional anesthesia, and if the horse responds to it, it's because probably it's the source of the problem. The treatment is rest, box rest, with anti-inflammatories and good trimming, or even some shoeing. Another thing I think all the owners of draft horses come across with is chorioptic mange. What is it? Is a common problem of parasites that are all over the world, Chorioptics. This parasite likes to feeds on epidermal debris. They survive in the environment up to 70 days. And this is quite important to know. Why? Because if we do not clean the environment, they will not go away. So the transmission is direct and indirect contact. So fomites, cleaning material, the stall, all this can play a role. There is a larger population on winter. So the severe symptoms are seen in winter, where in the fetlock, where they have the feathers and the pastern, and in the tail. The symptoms are cramping wounds, intense pruritus. The horse is all the time itching himself, and it can be quite painful. So here, this horse, as you can see, was presented to us not such in a good shape. He has these long feathers, and he was extremely itchy and painful. And once we removed the feathers and we did some clipping, as you can see, he has all these folds and nodules, which is chronic progressive lymphedema. I think owners of draft horses come across with this, unfortunately, quite often. And this is a quite severe case. So for the parasites, chorioptic mange, we have to treat all animals at the same time. The treatment is clipping, which can be a laborious work. You see our student trying to clip, and this can take quite some time. Apply topical treatments. Sarnacurana is the name or commercial name. Regular bathing horse extremities with non-irritating shampoo and drying. And of course, once again, disinfection of the environment, as I mentioned. Chronic progressive lymphedema, so the nodules that I mentioned. I placed this image from an article to give an idea of the evolution that this can have. So what is it? Is a progressive swelling and marked disfigurement of the distal extremities. The symptoms are skin folds, ulcerative nodules, and secondary, the bacteria and the parasites, they come, which makes the thing much worse. The diagnosis is made by the clinical presentation, palpation, clipping, and radiographs. As you can see on the radiographs, we can have an idea of how many folds it has. The cause, there is a genetic component, and the treatment is clipping the feathers, apply sulfur-based shampoo, keep it dry, and do exercise. So exercise is going to help, even with some bandages, and walk exercise is going to help the lymph come back and have some flow in order to diminish. The prognosis is extremely guarded, and it can lead to lameness and even premature euthanasia. So this is the horse. Sometime afterwards, you see that the hairs is coming, some zones of ulcer, but much better than before. I think this was 3 weeks afterwards. Lameness workup. So do we do lameness workup in draft horses as light horses? Yes, we do. But this can be a challenge for the vets. Why? Because inspection is extremely difficult. They have all this long hair. Palpation, they have a thick skin that doesn't allow us to feel the tendons on all the structures. Diagnostic anesthesia, you see here we are pinching with small needles that allow us to know. So we always start the regional anesthesia distal to proximal in order to know which part the horse stops being lame afterwards and which part is affected in order to do complementary exams. So in a light horse breed, it's quite easy because the skin is very thin, but in a draft horse, it can be quite of a challenge. The hoof testers, as I mentioned, can be as well difficult if the horn is quite hard. Dynamic exam, well, these horses are quite well behaved, but they don't know how to lunge, and they don't know how to gallop, and that can be a significant info. Radiograph, sometimes we struggle because there is a lot of muscle, and the ultrasound, we have a thin skin. So this is to show you a horse that was presented with a big tendonitis. And we are doing a flexion test, and you're going to see that he's quite lame on his left hind limb. So this is a quite clear lameness, but it can be sometimes more challenging than this. But this is a good lameness, so we see it quite well. Regarding the joints, so what we see most on draft horses, it's quite common, it's ring bone disease or osteoarthritis. So on the left side, you had a radiograph of a normal horse. These lines, dark lines, are the joints, so the distal interphalangeal joint and the proximal interphalangeal joint. And on the right side, as you can see, this line disappeared. So there is a lot of bone proliferation. Basically, it's a degenerative disease of the joints. It can be caused by a single traumatic event, chronic overuse, or even the conformation and the weight. If we think about it, draft horses that can have a huge weight in such small feet and joints that can lead to the osteoarthritis. Tendons can be quite of a challenge, as I said, to diagnose because of the thick skin. But here, as you can see, we have a hole where it shouldn't be in the middle of the tendon. So this was the one that we managed to find the reason why he was lame, but often there is a guarded prognosis. Sweeney, fortunately, we don't see that much. It was due to repeated trauma to the shoulder region from poorly fitted harness collars. The definition atrophy of the shoulder muscles is basically due to suprascapular nerve paralysis. So basically the harness would make a trauma continuously that would lead to a nerve lesion, and secondarily the muscles would disappear. Polysaccharide storage myopathy. I don't know how many people heard about EPSSM. but basically it's a polysaccharide storage myopathy, so abnormal accumulation of glycogen. Glycogen is basically a form of sugar that's stored on the muscle. The draft horse is presented with episodes of muscle stiffness, not willing to work, trembling, sweaty, very much pain after exercise especially. And basically there are two types. Type 1, it's due to a genetic mutation, and this gene can be identified if the vet sends hair or blood to a labo. This mutation causes muscle cells to produce glycogen continuously, so it doesn't stop. And the PSSM1 has been reported in more than 20 breeds, among them draft horses. PSSM2 is more through muscle biopsy, because actually we do not know what is the cause. So muscle biopsy, which is done usually the semimembranosus, semintendinosus muscle, and this PSSM2 also results in abnormal glycogen storage in the muscle. And how do we manage this disease? So there are two things to keep in mind. One is the diet. Diet is very important. So if the horse is fed with supplements, the supplements will have to make sure that they have less than 12% of non-structural carbohydrates in order to keep blood insulin levels low and the glycogen storage as well low. A good quality hay has a huge impact, as well as exercise. So we shouldn't exercise too much, but we shouldn't do rest neither. So daily exercise in order to work the muscles and burn that energy is very important. Affected horses are often easy keepers, and how to prevent, well, genetic testing. I would say this is very important because it's an autosomal, especially PSSM1, of course, autosomal dominant trait. So it means that if the father or the mother has the disease, the foal is going to have the disease for sure. And this can be tricky for our surgical department. Why is that? Because this can lead to risks of anesthesia. So we know that this disease has a high prevalence in Belgium draft horses. And plus the weight of these horses that placed during the recumbency, so he is on lateral recumbency, all these mass is going to be supported on the same side, sometimes for hours. And unfortunately, some horses do not present any clinical signs until they are submitted to surgery and anesthesia. So environmental conditions, once again, can trigger this problem. The prognosis, there is no cure, but it can be managed successfully. 50% of the affected horses with PSSM1 show improvement under diet management and exercise management, and 90% of those had few to no episodes of Tibet. So this is really good. I just placed a small note for anesthesia. Post-anesthetic myopathy is related to, so draft horses, we try not to get them in general anesthesia unless it's absolutely necessary for the horse. And we always have to keep in mind the duration of recumbency, the horse size, and the weight. Why? Because they can get a compartmental muscle pressure, which leads to hypertension, so less oxygen available, and reduced tissue perfusion. Plus, if we think that the ventilation is not so good because the lungs cannot expand as they should, all these can trigger problems on recovery. Neuropathies, which means the horse develops a problem on the nerval part and is not willing to support a limb, for instance, they are more associated with improper padding. So it's very important that the tables are well padded. Respiratory issues. So there is something called laryngeal hemiplegia. What is this? This, I'm put it very simple and straightforward. This is a paralysis of the nerve, the recurrent laryngeal nerve. The cause is unknown and usually is on the left side. The complaint is the owner says, my draft horse is making a funny noise, especially when he works. So he roars when he works. The diagnosis is made with endoscopy. So basically we went with a camera and we see, actually this is a draft horse we had recently, and you can see these are the arytenoids. So these are the cartilages that give access to the trachea. This is the epiglottis. And basically this should be totally open. And as you can see, they are quite collapsed. So there is not much air going on here. Something interesting to know is that actually draft horses are prone to this problem, especially they are diagnosed between 7 and 9 years old, and the treatment is surgical. So we do a ventricular chordectomy or with a tieback usually. The prevalence is higher, as I mentioned, especially in Belgium and Portugal. So I put this video for everyone to see what is a draft normal horse. So he's opening both arytenoids quite high. There is a symmetric abduction of both arytenoids. So they are working good, which means the airflow is passing by as it should. So this can have a huge impact on the performance of the draft horse. If sometimes they come in such a distress of respi part that actually we have to do a tracheostomy. So basically we have to place a tube in the trachea because the arytenoids are totally collapsed. So the horse is not able to breathe by himself. So we have to make a surgical intervention, small surgical intervention, and place a tube to help the horse to breathe by himself. The standing laser ventricular cordectomy that I mentioned, we do it standing. So here we are all checking the endoscope and we are passing the laser in order to get the ventricular and the vocal cord. So this is before surgery and this is after surgery. We remove this part of the tissue to get a bit more opening. And then the second part, which is called the tieback, we aim to fix this part of the arytenoid more open by placing a prosthesis. And in this way, the horse can have a bit more airflow, while especially when it works, because they might collapse. Draft horses subjectively appear to be narrower in the nasopharynx than a typical thoroughbred. So this is quite important as well to keep in mind, which makes the surgery more difficult than a thoroughbred. Finally, reproduction. So prepubian tendon rupture is common in draft horse. This is a serious condition that can compromise the life of the mare in the foal. Something also to keep in mind is that draft horses, along with Shetlands, they have unproportional foals, which makes many times the foaling more difficult and should be actually assisted. And sometimes when we do not manage, even if it's not because of the position, because he's well positioned, but sometimes they can lead to a cesarean, which is a surgical intervention that we do quite often as well. So this is the bibliography. And I would like to thank you all for paying attention, and I'm happy to answer some questions. Thank you.
Thanks a lot, Sofia. Can I please ask you to stop sharing the...
Yeah, sure. Sorry.
Yeah, perfect. Thank you so much. I know how difficult it is to cover all these topics, but it really shows some of the most important problems affecting draft horses, and I believe some of the vets in the room saw these problems for sure, and some of the owners identify some of these common situations. I will jump into the questions if you don't mind. I have a few comments or questions here with me, but for now, Claudia is saying, good afternoon. In the case of canker in the four hoofs, we must bandage the four to make the treatment. Won't the pain lead the animal to permanent recumbency? How do we prevent it from developing colic? Affecting all four extremities is recurrent. Thank you. And then there's another question from her. Yep.
That's a good question. So if it's affected on the four, we do the intervention on the forefeet. Usually we do it under general anesthesia. We place a tourniquet because this bleeds quite a lot. We try to minimize the time of surgery for the reasons that I just mentioned. We do the surgical resection. Surgeon along together with a farrier. We place bandages, and usually we do, of course, antibiotics and anti-inflammatories, to which the horses respond super well. We change the bandages 24 hours afterwards because of the bleeding is quite profuse once the horse is up, and as you can imagine on recovery, they always bounce a bit. So once we remove the tourniquets, it tends to bleed. But we do it as well with regional blocks. Not only they are on general anesthesia, but regional blocks, and usually they respond super well. And I don't have any case that I could remember that had laminitis or recumbency due to pain in this situation. Because actually think these horses, this is a painful situation, which they have been leading for quite some long. So I don't know to which point the surgical plus with all the medication that we give, it's going to be worse.
Okay.
Did I answer everything? Colic, that's a good question as well.
Yep.
So for prevention of colic, we do pass a tube with paraffin and laxative, a couple of them, to prevent exactly the colic. and we make sure that we see that the horse pass fishes and eats well, and especially on the 48 hours post-op. We do quite a surveillance. Our interns do a good job because they almost sleep in the hospital doing that. So we keep a good eye on them regarding the comfort, physical exam, how many times they pass fishes. But we do, in the majority of the cases, pass paraffin at least and a couple of times of electrolytes by the nasogastric tube.
Perfect. And now, in terms of the respiratory problems, Claudia is also asking, how can we avoid the pneumonia aspiration after surgery in the case of laryngeal hemiplegia? So
that's a good question. Actually, there is an article saying that, and it's true, that unfortunately we do not get the abduction, maximum abduction. So after surgery, there is always a decrease of that abduction that we ideally want of fully abducted. And draft horses, unfortunately, they have more propensity to diminish even more after. So the abduction is not to a point that it's going to lead for pneumonia, aspiration pneumonia. It can, if you do it bilateral, for instance, but we don't see that much because unfortunately the results they are not as good as on the thoroughbreds, for instance. It can be quite of a challenge on draft horses.
Thanks, Sofia. Let's wait to see if there are more questions on the chat, but I do have a couple of questions here. Thanks for mentioning tetanus. It's indeed a very serious problem, but I'd like you to comment on the fact, what would you advise as vaccination for owners, especially thinking that new diseases with all this climate change, and we see vectors appearing in Europe that they usually were not here. So if me as an owner ask you, what should be the best protocol in terms of vaccinations for my draft horse, what would you recommend?
You know, draft horses can be as well a challenge on the costs part, because everyone wants to know the prices of the things and how much does it cost and what do I gain exactly. You know that tetanus, of course, it comes with influenza. For me, these are the basic of the basic that should be done annually. And you ask me, yeah, but tetanus, it can go up to 3 years. Yes, so it can be covered up to 3 years. But at least annually, those two that come together, for me, I think it's the mandatory for any draft horse. Okay. I wouldn't go very far away with respiratory or herpes virus or something like that. I would keep it simple. For me, tetanus plus influenza together annually, for me, it's fine. Cool,
good. Thanks for that. You mentioned something really interesting when you said that you don't see too many cases now of the atrophy of the shoulders. Is that because people are using better harness, or is that because they're using less draft horses?
I was hoping that you would answer that to me, because you are specialized on that department. I do want to believe that people are doing a better job and choosing better. I'm sure that maybe you in your trips in Africa, Mexico, those countries where we see a lot of working animals, where people do not have the systems that they would like to have, you see these kind of cases.
Yep.
Here, I would like to believe we are doing a better job. And for this reason, we do not see often. Actually, I asked Sigrid for a picture and she couldn't find me a draft horse, which is a really good sign, taking into account how many years she has as working here. So, yeah.
Good. And in terms of the chronic progressive lymphedema, is there any genetic basis for that?
Yeah, so that's why actually draft horses, when they pass on the stud book, they come to us and we do check if they have 2 testicles in place, if the jugular veins, I check them, how do they walk, how do they trot, not that this extremely important. They do endoscopy for the respiratory part, and we do take radiographs, and among the radiographs, we have a scale for the chronic lymphedema. So that plays a role actually when they are deciding for the stud book. I cannot get into much in detail because I'm not in the commission of the Belgium draft horses regarding that, but I do know that we have to mention which grade the horse presents. Taking into account the radiographs. So I do feel with the palpation, but the thing that's going to make it clear for the stud book it's the classification given by the colleague on imaging once they perform the radiographs. And it has a genetic component. So I think that's important as well to know and emphasize.
Pete, may I ask you how relevant this disease is for you being a breeder for so many years and being part of the stud book of the Ardennais horse in the Luxembourg? Is this something that the owners take into account?
My experience is my personal experience and my experience as as chairman of the breeding association is that, let's say, 90% of the problems we have with draft horses are problems with feet, with hoof. And personally, I didn't have any other problems. I had Ardennes draft horses for almost 30 years. I had never any problem except for problems with the hoof abscess or something like that.
Okay, thanks, Pete. As a curiosity, when I brought a draft Ardennais mare from Luxembourg in 2015, in the first summer here, I had a suspicion that actually the horse had PSSM because the animal was sweating, but then I realized that it was just summer in Portugal, and exactly, it was just the temperature. The animal was the first. The animal came at the end of, well, came in the summer, but it was not an extremely hot weather. Then all the winter, and then the animal was in Portugal. And starting in May, every time the animal run a little bit or working a little bit, and I saw it was something that disappeared over time with the animal getting used to our weather and working under those circumstances. But so that was a fake positive.
Yes, thank God.
Yeah.
So I totally understand the horse because I struggle here with the Belgian weather in the winter. So as a Portuguese, I can confirm that they might have some struggle in our summer months.
Well, I'd like to ask the room if there is any other question to Sofia. Well, if not, Sofia, thank you so much for your time.
Thank you once again.
It was a pleasure to have you here with us today. To all the participants, thank you so much for attending, and we'll let you know soon about the next FECTU webinar.
Thank you.
Tamlin is saying thanks, and people are saying thanks. Thank you so much, Sofia.
Thank you so much.
Bye-bye.
Bye.
Bye.